Hi everyone, I'm Robin from Tapp. I'm a clinical psychologist here in Pewee Valley, Kentucky. And today I wanted to introduce you to a deep breathing meditation. It's one that has a lot of good research to support it for improving your immune response, which is kind of important right now. It also is something, a version of this is often used by respiratory therapists to increase lung function. So if you do get a respiratory infection, which is, again, something we're a little concerned about right now, but also it helps regulate strong emotions. So it allows you to have feelings of anxiety or depression, which are common for some people right now. And so it helps to manage some of that. It doesn't make it go away, but it will help to help particularly this part of your brain here, we call the frontal lobe, the part of the brain that sort of controls other parts of the brain. And it helps that part of the brain regulate our strong emotions. So we still feel it, but it doesn't overwhelm us in the same way. So for this exercise, we're going to start really simple. Please be sitting or lying down because some people do get a little dizzy. And then also make sure when you do this meditation that you go to the point that's comfortable for you. So we're going to go all the way up to 612 or maybe 812 beats. But some people may find that they don't have the lung capacity currently to do that. And if you don't, that's just fine. Stop wherever you are comfortable. And then just practice it. And hopefully over time you can get a little better. So we're going to begin with just a simple 4-8 breathing. And then we'll move up. And eventually, like I said, get to 612, maybe 812, depending on how I'm feeling. I'll be counting it out for you. And then finally, we're going to add in a visualization. We're actually going to feel this area in our really lower belly get hot. We're going to visualize an ember or flame growing in there with our breathing. And that helps the frontal lobe sort of regulate activity in a part of the brain called the parasympathetic nervous system, which is a part of our brain that we sometimes refer to as the rest and digest part of the brain. It helps us heal ourselves, care for ourselves. So let's go ahead and begin. Get in a nice comfortable position. Again, because some people get a little dizzy, make sure you're seated or lying down. And then just go ahead and begin. Take a nice normal breath in. And let your mind begin to turn towards your breathing. Noticing the breathing in, noticing the breathing out. You can close your eyes or you can leave them open if you're more comfortable doing that. And I invite you to bring your eyes particularly to bring your attention particularly to your sinuses. That is the little caves behind your nose and below your eyes. And so when you breathe in, you'll notice that they cool. And when they breathe out, you'll notice that they warm. Just like that. It's perfect. You may begin to feel yourself relaxing even as you're doing this. And if you do, that's fine. If you don't, that's fine as well. And now we want to begin to regulate our breath. And that is, we're going to use this front part of our brain to control our breathing. And we'll start with a 4-8. And what that means is we're going to do a 4 count in like this. 1, 2, 3, 4. We're going to hold it for just a second. And then we're going to breathe out a really deep breath, pushing from that lower belly. 1, 2, 3, 4, 5, 6, 7, 8. In. 1, 2, 3, 4. Hold it. Out. 1, 2, 3, 4, 5, 6, 7, 8. In. 1, 2, 3, 4. Hold it. Out. 1, 2, 3, 4, 5, 6, 7, 8. Continue that pace. 1, 2, 3, 4. 1, 2, 3, 4, 5, 6, 7, 8. Continue to do that. And now for those of you that can, on your next in breath, we're going to go to a 6 count. 1, 2, 3, 4, 5, 6. Hold it. And on our out breath, we're going to go, let's go to a 10 count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Keep on going in on 6 count. 1, 2, 3, 4, 5, 6. Hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Keep going that way. And when you're pushing out, go way down deep in your belly and really squeeze that really lower part of your abdomen to get those last couple. Good. And now let's expand it to 6, 12. So in 1, 2, 3, 4, 5, 6. Hold it. Out 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Good. Back in. 1, 2, 3, 4, 5, 6. Hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Good. And keep on doing that. And this is hard. If it's too hard, it's okay to drop down a little bit. But if you can, try to stay here. This is very effortful. Lots of frontal lobe activity. That's great. We're changing what the brain is doing on purpose. And this is a really powerful tool for people who want good mental health. We're also changing how the body is behaving. We're changing our wellness in terms of our immune response, in terms of our lung capacity. We're doing lots of good physical things here. Very good. And if you can now, if you want to go to an 8-12 or even an 8-14 or even an 8-16, that's okay too. Just deep, slow, very regulated breaths in, and then deep, long pushes from way down from the bottom until you get every little drop of air out. That's what we're doing here. Do it as long and slow in as you can and as long and slow out as you can. You can't take it too far, so if you start to get a little lightheaded, you may want to dial it back just a little bit. There are some practices that will take this up to 30 seconds or even a minute. I'm not going to do that today, but you can keep playing with this and increasing that length. Again, don't do it so far that you're causing yourself to lose oxygen, but nice long breaths in, deep long breaths in, and then really long, slow breaths out. For most of you, this part, you can probably feel your heart beating now. That's really wonderful. That is a good experience. That means you're being really mindful and engaged. Now I'm going to ask you to add one last component, and that is on the breath in, I want you to imagine there's a little ember, a little tiny piece of fire down in your lower belly, down below your belly button. And as you breathe in, I want you to imagine it glowing and even turning into a flame. And feel the heat right down there in your lower belly, like feel that warmth. And then as you breathe out, feel that heat slowly extinguishing. Till it's just the tiniest ember. And then you breathe in again. Feeling your belly warm and seeing in your mind's eye the glow increase. And breathing out, feeling that heat slowly dissipate. And the glow going down, but never completely out. Yes, wonderful. Very good. And now I'm going to invite you to just let your breathing become normal again. And just noticing that. And many people notice that now they're just naturally taking longer breaths, even when they're allowing their breathing to become normal. They're taking longer, deeper breaths, which is really good for you and very protective in lots of ways, psychologically and physically. So just let your breathing be as normal as possible, but you may notice that it's a little deeper naturally now, and that's okay. You may not notice that either, and that's okay too. We're just going to keep practicing this. I encourage you to practice this 2 or 3 times a day. I really like this practice in the morning as a way to wake up. I also use it when my feet are cold at night. It actually helps warm my feet quite a bit. Some people will do this exercise having the heat in the palm of their hands. There's actually been several studies, really good studies, that have shown that if you do this exact same exercise but the heat's in the palm of your hand instead of in your belly, that actually drastically reduces migraine headaches. And so and there's some pretty cool studies around that support the use of that. So feel free to use this whenever you want, and as long as it's safe. Remember to be seated or lying down, because some people do get a little dizzy, lightheaded, especially when they're going longer and longer and longer. Thank you for listening. Have a great day. Be safe, be well.